Prof. Pillay is an endowed professor of medicine and assistant dean, executive director, and chief innovation officer at the University of Alabama at Birmingham in the United Arab Emirates in the UAB. What's it?
University of Alabama at Birmingham.
Yeah, it's the health head. Yeah, University of Alabama. Um, where you live, I innovation initiatives. This of
Bongani, I think, hello, I think we have
healthcare
lost.
academic medical of female.
Okay, we seem to have lost Bongani. So like Bongani was saying, we'd like to introduce Professor Ruben Pillay. He's also the chief executive officer of the American Health Institute and the editor-in-chief of the Journal of Innovation and Entrepreneurship in Health. He has a PhD in business administration and an MBA and MSc in health management and in medicine. He has published widely in the field of strategic health, leadership, and innovation, the futures of medicine and AI, and digital transformation in healthcare. He has delivered numerous keynote and TEDx talks on the future of health and healthcare. He is passionate about empowering health professionals to future-proof themselves and their organizations. So without further ado, let me introduce Prof. Ruben Pillay to the platform. Thank you, Prof. Over to you.
Thank you, Kulsum. Thank you, Bongani, and welcome to everybody. Let me just share my screen with you. I'm assuming everybody can see that.
Yes, we can. Thank you, Prof.
Okay, so as I said, thank you very much. I really appreciate the opportunity. I'm not sure how common it is for this group and listenership to have a physician and AI specialist talk to you. But I think it's pretty timely in the sense that a lot of challenges that our sector faces, the same challenges that you face in the public service. So what I want to share with you today is essentially how do we leverage digital technology and artificial intelligence to solve the cost, quality, and access issues that dominate health systems globally. So this is not just a phenomenon of South Africa or LMIC countries. It's a global problem. And although I'm based in the US, I work globally, and the problems and challenges are pretty much the same. I also work in public administration, and so not only are the challenges faced similar, but the opportunities to leverage digital technology and artificial intelligence to resolve them, apply across sectors. So what I want you to do is see today's presentation as a case study of how you could leverage digital technology and artificial intelligence, because we can actually apply pretty similar technologies across sectors, especially in the public administration and public health sector as well. What you see in this video is something that's already available and used, and it demonstrates how you can use the Internet of Things to essentially not just monitor patients' lifestyle at home, but if they have illnesses, we can monitor in real time. And we have the ability to link that with the health services. Okay, that's really critical. And you can see in this video that, you have this diabetic patient, an asthmatic kid. We're tracking them in real time using digital technologies. And if they have some kind of medical emergency, the health system is informed, and the health system can make the necessary arrangements to receive the patient, make sure that they have the adequate resources, both human and otherwise, to manage the patient. So, it's end to end. It's digital technology and Internet of Things at its best, and underpinned by a lot of artificial intelligence as well. Now, what are the big challenges we face in health and healthcare? As I said, they're pretty similar to public administration. One is the expenditure is rising. In the US, it's not a good example. We spend about 20% of GDP. The WHO recommends countries spend about 9% of GDP. I think South Africa is pretty close to that. But the point is that it costs a lot. It's a significant percentage of fiscus goes into healthcare. Now, that is not a problem if the outcomes are commensurate with the investment. The big issue we have globally is, despite their investment, the healthcare outcomes make one question, how that.
Link.
Go ahead, Kulsum. The outcomes actually lead one to question, how's that significant expenditure utilized? That's the first issue. The second, in healthcare, we have a major challenge in terms of workforce. The shortage of across the board, be they doctors or nurses or allied professionals or support staff. Okay, there's just no way that we can train enough people to meet the increasing demand. I was in a presentation by the Minister of Health yesterday, and he spoke about the challenges, the workforce challenges that we have. Okay. And obviously, you can talk all you want about workforce challenges. The reality is the supply side for workforce, our ability to train sufficient doctors and nurses and specialists, just don't exist. So even thinking about a human resource strategy is, I kind of describe it as fool's gold at the moment, because we just don't have the capability to provide that workforce. People are living longer, but the reality is they actually are more ill the longer they live. So although we're increasing lifespan, health span is dropping, and that has an economic cost to it. It has poses its challenges in terms of our ability to provide increasing demand. Okay, so the situation is going to worsen. One, because of aging; two, because of increased demand; and three, because of obviously the shortfall in workforce. There's also a major disparity we have in terms of how care is provided and what the outcome is. Now, that's the same problem most of you guys, experience all the time, the disparities in access to public services. And the disparities, could be across the board, could be geographical, could be demographic, political, there are many reasons to drive disparities. We have exactly the same problem in healthcare. The confidence or the percentage chance that you have of surviving an illness really depends on where you are geographically, which is a pretty scary thought, that and an indictment on our profession, on the health profession. I think disparities in terms of quality of care and access to care is arguably one of the biggest shortcomings of the health profession. Now, this slide you see is actually developed countries. It's the OECD countries, or so-called Western world. And you can see, even in the Western world, there's a disparity. Whether you survive childbirth depends on where you are. As a child, whether you survive the first 1 year depends on where you are. Your chances of surviving an acute myocardial infarction or a heart attack depends on where you are. So this is a major issue and challenge that we face that needs to be addressed. We also practice what I called imprecision medicine. We don't treat patients as individuals. We treat them at an aggregate level. So it's a big problem that I have personally as well, the concept of this average patient. And, the profession, I guess, needs to acknowledge that first, this is the way we practice. Our treatment protocols, our diagnostic approaches, etc., are all based on an average patient. But yet, nobody's average. None of you listening today is average. You're each unique in your own specific way, but the way medicine is practiced is on an average basis. And as a result, you find that the response to treatment is not the same for all patients. Now, I'm using one example here of 10 of the most prescribed drugs in the USA. Now, a lot of these drugs will be familiar to you. Maybe some of you may be using some of these drugs. Nexium is pretty common for ulcers. Crestor is pretty common if you have hypercholesterolemia, etc. The point of this is, of the 10 most prescribed drugs, they only work for 10% of the people who use it. So there's a very good chance that medication has been prescribed to you that has no impact on you. Okay? It's just the way medicine is practiced. And clearly, that's not good enough for us. We need to become much more precise and personalized in the way we deliver care. Okay, so that's just a bit of the background. I want to go into digital technologies now and why we think digitization and as the introductory video said, pursuance of e-government is really critical. Because when you start digitizing things, three things happen. Firstly, you can democratize access to services. Secondly, you demonetize it. You can make it free. And thirdly, you can dematerialize it. In other words, you can make it small and commoditizable. Okay? Now, there's several examples. So in other words, digital technology actually makes products and services smaller, cheaper, faster, and better. Now, smaller, cheaper, faster, and better is something healthcare can benefit from, but it's something the public sector and public administration can benefit from. So, it's a compelling reason to pursue digital technology. I mean, you can see when you democratize or when you digitize banking. You don't have to go into a bank. You can do it digitally. The cost to do digital banking is free. Or I think it should be free. It's portable. You don't need any infrastructure. People do it on their phone. And, the same with travel and the same with many things. When you digitize them, it has this impact. It has these kind of democratization, demonetization, dematerial, smaller, better, cheaper, faster, better. Okay, so that's the disruptive potential that digital technology holds, and one of the reasons that we use that. Okay, the smartphone or the phone has followed a digital pathway. It's moved from analog to digital. And as you can see, I'm not sure what your age group is, but some of you are probably going to identify with the phones from the 60s onwards. But you can see that it took decades, arguably, a century or longer, to get to 2000 and to 2000. So about 124 years. And if you go back to this graph, you can see the initial portion of this slide is very linear and slow, and then it takes off. Okay. Now that's the outcome of digitization. This is called the exponential pathway that digital technology follows. You can see it here, the slow linear, and then suddenly from 2000 to where we are today, 2025, the device you have in your hand is, the least important function that it performs is actually a phone. It's been disruptive and changed our lives, made a lot of things freely available, like the news, et cetera, et cetera. So this is an example of exponential technologies, so I've got a question mark at the end of the smartphone. I know the Samsung, that this is the first one in 2010, iPhone in 2007. I think we're at 18 now, so almost a update a year. So what's next after the smartphone? Any guesses? Anybody? What's going to happen next? Well, if you don't want to guess, then I guess I just have to share the answer with you. And actually, we already see the solution is available. Okay, the smartphone is going to become redundant soon. We have a little device now that you can see you put on your lapel, and essentially it performs all of the functions, but it uses artificial intelligence. So you can see here dematerialization. Even your smartphone is going to be gone. Okay. This device is pretty cheap, so dematerialization, and everybody's going to be able to access it. Okay, this is the impact of digitization, and you can see the potential for disruption. Okay, this device is AI driven, and essentially becomes a personal assistant and not just a phone. And these devices are, as I said, they're available. Okay, so now AI, digital technology, has tremendous potential to transform sectors. It has. All of you on this call are beneficiaries of these advances, of technology. And as I use banking as an example, telecom communications is a good example that, if you recall way back when it was just the postal service, I think, installing phones and issuing out telephones, all that has changed significantly over time, with the end result that, everybody on this call has a phone. Everybody on this call can transact financially here. The reason that affordability of cars has gone up is because they use technology to improve productivity. Okay. Now look where healthcare is. So we don't do too well with technology. And healthcare is one of the unique sectors, is when you introduce technology, costs go up and access goes down. So it's a big problem. But then look where the public sector is. It's worse than healthcare. Okay, our ability to translate technology and innovation into impact in both medicine and the public sector is way, way, way behind most other industrial sectors. Okay, so the upside is you have a tremendous opportunity to change care delivery. So if, of course, we leverage it in the correct ways. We're using a lot of artificial intelligence in medicine now. So across the board, I'll just skip through this, but we're using it to improve the quality of care. Now, as I said, there's a big issue in terms of quality. You can see here in the US alone, about 800,000 people die or permanently disabled from poor medical care. 7 million incorrect diagnoses just in the USA alone. So from a diagnostic point of view, on average, the health profession gets it wrong about 12% of the time. That's pretty high. So 1 in 10 or more than 1 in 10 patients, the likelihood that you misdiagnosed or treated incorrectly is pretty high. So we're starting to use artificial intelligence now. This is, Watson, IBM's Watson, and we use that to, determine cancer care. So it's pretty precise. It's based on, what your clinical record is, et cetera, et cetera. And we feed all of this into the artificial intelligence platform, and that actually matches the most appropriate treatment to the patient. So we're using that to improve diagnostic capability. You can see this example where we're using AI to interpret X-rays. Okay, and when you feed a chest X-ray into an AI model, it doesn't only read for lung pathology. It can pick up other issues as well. Like in this, we can diagnose type 2 diabetes, we can diagnose cardiac risk, et cetera, from a plain chest X-ray. Chest X-rays are pretty common. So if you use AI, it could become a pretty valuable diagnostic tool. There's a whole host of other AI-based solutions that help diagnosis. You can use your smartphone to diagnose respiratory disease, facial temperature to diagnose diabetes, etc. You can only do this with AI. Humans don't have the processing power and capability to do this. Medication errors are pretty common, especially, and can be fatal, especially if you're receiving an intravenous, an IV antibody medication, okay? And because it can be fatal and it's so common, we're using computer vision and artificial intelligence to be able to reduce that error rate. So we can do that, and we're using that as well. We can use AI to predict patients who are at risk of injury or falls, etc. And you can see these solutions are not only used in hospitals, we're starting to put them into homes as well, especially in assisted living, etc. So it uses computer vision to do this, and it's able to predict risk. Okay, it doesn't help when somebody already falls and you phone the ambulance. The power of AI is its predictive capability. We also use this to improve safety in operating rooms. Surgical errors are not uncommon. And by installing artificial intelligence and using camera vision, we can actually improve the safety of surgical procedures as well. So, some really good examples. One of the big impacts of AI and digitization is it actually empowers patients to deliver their own care. This is really, really important. I kind of call it prosumerization because it enables people to produce care. Because the healthcare system is a bottleneck, it's a roadblock. So when we couple patients or ordinary users with digital technology and artificial intelligence, they can deliver a lot of their own care. A lot of you now don't walk into the bank. You don't have to see a teller to do your transacting. You don't go to a travel agent to book flights. You don't go see a travel agent to book a hotel. You don't go to, physically walk into a car rental company to hire a car. You do all that yourself. And these are services that used to be provided by individuals, okay? And once individuals using digital technology and artificial intelligence are able to provide their own service, they're not consumers anymore. They're prosumers, okay? This is an example of how your smartphone is essentially can become the doctor's bag of the 21st century. We have technology that a 30-second video can actually diagnose specific conditions and almost perform a pretty comprehensive health assessment using artificial intelligence, okay? So a selfie or a TikTok video can become a diagnostic tool with AI. We developed what we call ambient intelligence, a lot of devices that we, put around hospitals and homes, etc. So you don't need a blood pressure machine or something to measure your glucose, etc. It's all monitored without you being involved. So it uses laser technology and radar technology and is able to track patients and monitor them as well. So, we couldn't do this pre-AI. We're also able to, monitor patients at home. This is a breathalyzer device. Patients with asthma, we can measure their compliance now by digitizing these solutions, okay? Compliance is a really big problem in healthcare. People don't take their medication. And for an asthmatic patient who doesn't use their treatment, it could be fatal. Now we can actually track that by putting sensors in the inhaler and linking it to the phone and linking it to the provider. We can actually track that, okay? This is the new generation clothing that we can also use to collect a lot of health-related data, and it helps us in diagnosing and monitoring patients. This little device is available to pretty much everybody. It essentially helps convert mums into pediatricians or primary care practitioners. It guides you through the clinical assessment, uses artificial intelligence so that you can pretty much diagnose your own family. And if, of course, you're uncertain or you want a teleconsultation, you're able to get that. If you have skin lesions, you don't have to wait 6 months to see a dermatologist now. You combination of artificial intelligence and digital technology, in this case, your phone, will actually provide you with pretty good diagnostic advice. Okay. This is FDA. All of this stuff, by the way, is FDA approved and CE approved. So it's kind of clinically validated. And do you need a dermatologist? No, you just need a smartphone. You need the app, and you need to be able to use it. So you can deliver your own dermatological services. You don't have to go to an optometrist anymore. They're pretty expensive. And, ultimately you end up with spectacles that you may not need and cost a fortune, but you can buy a little device now, attach it to your phone and do your own eye test. So not just for you, you could, all your family members too. And this device sells for $30. It's a bit cheaper now, and $30 about 550 Rand to be able to permanently monitor visual issues, not just for you, but for your family. Okay. So ultimately, if you use this solution once or twice, it's break even because that's what you would have probably paid in to see, so this is what I mean by demonetization. It can become free. Okay, it's small, it's dematerialized, and it's democratized. Everybody on this call can become an optometrist with this device. We also see that, with a lot of dental solutions now that you can use your smartphone, you can attach, you could diagnose dental conditions. All of these are available. We're in the process of launching an AI and digital technology training program for dentists in South Africa soon. And, one of the things we hope that they'll develop is solutions like this. X-rays, you don't have to go and see a doctor anymore. It's available, portable, and can be done by folk at home, or this is prosumerization. It's enabled by digitization. Prosumerization is the democratization that I'm talking about, that everybody should be able to access services because technology can help us do that. You can also do blood tests at home using your smartphone. You don't have to go to a lab, okay? And the AI in your phone will actually help you interpret it. So not only does it run the investigation or test, you actually can get an interpretation done too. So pretty powerful. This is prosumerization. Phone app detects strokes, just from using artificial intelligence. So just a selfie, and you can diagnose a stroke amongst other conditions. Now, it's really important to diagnose strokes very, very, very early, okay, so we can intervene. In this case, that diagnosis can happen at home. Look at this. You can diagnose early pediatric eye diseases using artificial intelligence and smartphone-based photography. Okay, you can diagnose respiratory conditions using your smartphone. These are, once again, these are all medically approved. Okay, so just having your phone on you and your phone listening to the way you cough and talk, etc., it uses all that information and diagnoses respiratory conditions. You can even get diagnostic tests that you would historically, have to go into a hospital to get done. You can get that done, at home too. You can buy this little pill cam, and essentially, you swallow this. You can get a colonoscopy done. And do it at home, okay? And it's $99. So what's that? About 1,800 Rand. You can get a DIY colonoscopy. Gastroscopy is pretty common, okay? Pretty expensive, highly invasive. They don't always show something, whether it's gastritis or ulcers or what. Most of them are negative. 80% find no disease. And the cost could be substantial. But you can use digital technology like this. It's a little pill. It's called the pill bot. You swallow it. You skip breakfast, 2 glasses of water. You swallow that, and you actually can get a diagnosis, okay? That costs $50, 750 Rand for a DIY gastroscopy. Try getting that in a hospital or at a private gastroenterologist. So this is pretty much 1/10 of what you would pay. Once again, demonetization, okay? 70% of cancer deaths from cancers without recommended screening. Okay, so this is it's a problem. This is why cancer is a problem. It's because our screening is not optimal. And now we have digital technology for patients to screen themselves. You know, you can do your own mammogram at home using artificial intelligence. You can track yourself every day if you have to and want to. You don't have to wait for a mammogram. You know, you can technologies like this blue box is pretty low cost and essentially uses urine to track for cancer. Okay, so the use cases go on and on and on. You know, you don't have to pay to have X-rays done anymore. You can actually, you know, upload images. You can try this, by the way. Go to this website. You can upload it and get a free interpretation by artificial intelligence. So you can also scale services by centralizing. The world's largest hospital actually doesn't employ too many doctors, but it's centralized. They're all located in one place. They get information from patients across the country, and using artificial intelligence, they're you know, able to provide the care. The minister last night spoke about the maldistribution of cancer doctors in South Africa, and in some places and hospitals, you have 57 cancer specialists in one hospital, which is more than 4 or 5 provinces put together. Now, that's not a problem if you have a good business model around it, okay? That these 57 guys may be located in the top hospital in Johannesburg, but why can't they use digital technology to provide cancer care and support to people in all of the provinces where it's required? So, you know, this is one of the reasons why we do so badly is we don't think of creative business models to go with digital technology and artificial intelligence. You know, you can see we're able to democratize access to testing. Now, this is, you know, like a modern ATM. You go in there, look, it takes your image of your eyes, but it's not an eye test. It does, you know, it assesses and evaluates you along multi-dimensions. We also have robot technology to pull bloods for you, so you don't have to go and queue up at a lab or doctor. These robotic devices could be put anywhere, you know, convenient for patients to have blood draws, etc. So important, okay? This is an example of how robotic technology and AI can work together. And in this case, this is an example of a dental procedure happening. There's no dentist here, by the way. Okay, this was the first fully automated dental procedure. So, you know, future dental assessments and even surgical procedures, you'll just receive a QR code on your phone and you go to this automated center, you feed the QR code in, and then, of course, you know, it's programmed to do the procedure on you. This is an example of that too. We're using robotics in healthcare for a lot of the services, and you know, I guess I can go on and on. But what I'll do is, you know, for Bongani and Kulsum, etc., I'll stop there and take some questions so that we could be on time in terms of you know, how we're changing healthcare and what the application is to you. So I will happy to stop sharing my screen, Bongani, and go from there.
Thank you very much for that insightful presentation, Prof. I was very attentive. I've learned a lot. And in part of that learning also, I have questions, just few conversation between myself and you, then we hand over to the audience. There's no doubt that artificial intelligence is quite crucial for us to meet the sustainable development goals, especially the ones that are related to health, because it makes health accessible. I mean, the issue of
Mhm.
health is one
Yeah,
that is lagging behind in the United Nations Sustainable Progress. It's affecting children from going to school, the issue of maternal
right.
health. But a key concern for me, I agree that artificial intelligence
Mhm.
expands access and it
Right.
makes it cheaper and more available to many people. But what are the risks with open source softwares, technologies that are available out there, which may
Mhm.
not be regulated? I know that in your presentation, you mentioned things such as the approval from the FDA.
Yeah.
But we all know that actually, when you go to your app store on your smartphone, there are many applications that promise results and that may not be regulated.
Right.
And if it's being used by a layman like
Right.
myself, who is not
Mhm.
from the
Right.
medical industry,
Right.
to use it to diagnose patients, what is the risk? How can we regulate these readily available open source technologies that are available there to
Yeah.
promote access to health? Issues of X-ray, Prof. When you do an X-ray, you have what we call a radiographer. Then you have a radiologist that actually interprets the
Mhm.
X-ray. But if I have that application, I'm not even in the health sciences. I'm not a nurse,
Right.
even at the basic level. Then how can we regulate that? Thank you.
Right. Yeah, really good question because regulation in healthcare is a big thing, but it's really important, especially to build trust, not just amongst the patient base, but with the doctors and the health professionals as well. We embark on campaigns to educate as well in terms of what to look for in the device or in the digital solution or in the platform-based or open source solution in terms of validity. So clinical validity for us is really important. And my approach to that is folks should only use digital technology that's prescribed to them by a provider. Okay, and what you do is you hope that the provider has done a due diligence on the clinical validity of that. That's the first thing. The second thing is, we're also on a drive to educate patients in terms of how to screen what technologies they should use and what technologies they shouldn't use. So, the average patient should have an understanding of what a FDA approved or SAPRA approved device or solution is. And it's all education and training, and that becomes integral to making access of these solutions available. So that requires a redesign in how patients are managed in a clinic or a hospital. When they leave, now they go to a pharmacy, they collect the medication, and they go home. Should we not have another stop is when they leave, they go to a department that's focused on digital technology education for the patients. You see a diabetic patient or a hypertensive patient, they can collect their medication, they go to another counter where they are helped with either remote monitoring devices, downloading the requisite app, they get taught how to use it, they get taught how to interpret it, et cetera, et cetera. So, I showed you a slide earlier on where the performance of healthcare literally sucks with technology. It's because we don't change the business and the operating model with technology. And it's really important. So, you can have the best technology in the world. If you put the great technology in an old business or operating model, it doesn't work. In fact, it has the opposite effect. Okay. So, yeah, it's, we have to control the access to products that are clinically validated. And that means care workflow changes. That means patient education. That means healthcare professional education. So that's the approach we take, even at where I'm based. It's the approach. We're engaged in a lot of training here in South Africa at the moment. I'm actually in South Africa now, and that's how we do it. But to the point, Bongani, is trust is critical. Okay, and if we don't get this right, trust levels go down, and if trust levels go down, adoption becomes a problem.
Yeah, thank you very much, Prof. We're going to move to questions that come from the participants to the web.
Mm-hmm. I think you muted.
With that. Okay. One question from the participants, they said, based on your digital maturity graph,
Mm-hmm.
why is there a low level of adoption of AI and digitalization in the healthcare sector?
In healthcare? In healthcare? Or the public sector?
Yeah, it says healthcare sector.
Yeah, it's multifactorial. I think one is the regulatory environment is pretty onerous. Okay, so it's not easy to, everything I showed you is FDA approved. It's the top of the iceberg. Not all of these companies can afford to go through the regulatory process to get FDA approved or SAPRA approved, etc. So that's one. Two, I think, cost could be another issue. I think three, a trust issue, so it's kind of social cultural issues. People are not comfortable in becoming prosumers in healthcare. They're too happy to do their banking and book their air flights and hotels, but I think it requires a cultural shift from patients as well. To me, I think the biggest difference, the biggest is what I spoke about just now. It is healthcare needs a dramatic change of business models and the operating model, to drive these technologies. If I give you the example, the reason that every one of you has a phone, every one, some of you have 5, 6, and 7 at home, is because the operating model, the business model for telecommunication is not the same. Now, if you go back, way back, not even that far back, you had to make a formal application for a phone. The South African Post Office or Telkom will take a year before they approved it, another year before they come and they install the phone with the line, etc. Okay? Can the cell phone companies stuck to that business model? Okay, we would not have democratized access to cell phones. The business model changed. And now you have companies going directly to the consumers with phone technology and a host of other products. Okay, increases demand mean that they have to increase productivity and supply, and they automate all of that. So it's a total change. That's what we need. Technology without business model innovation does not work. So, and that's a big problem in healthcare. We are a very legacy-based approach in terms of how we practice medicine. The hospital and the physician are still the epicenter of care delivery, and that model has to change. And AI and digital technology has the power to do that. I always say in healthcare, if you want to kill a technology, sell it to a hospital or doctor. It will never go anywhere. Okay, access to that technology drops and the price goes up. But if you democratize access, if you can go into ShopRite, Checkers, and any store and buy a blood pressure machine and something to measure your sugar, and it's simple to use, everybody can access it easily. So we have to radically rethink that. I mean, a lot of work on mine at the moment focuses just on that. How do you democratize access or commoditize access to medical technology? And as you can see, we're doing it already. None of these technologies that I showed you, they're not distributed to the public by hospitals and physicians. They also are companies that do it directly. So, that's kind of, I the main reasons for that, you know.
Okay, thank you very much for that. The issue of the democratization of access, for me, is one of the contentious issues, I believe. You touched on it a little bit there in your response, but what is the resistance from the medical industry? I mean, these are disruptive technologies. This is disruptive.
Yeah, I mean, I talk to physicians every day. It's like they are really, really intimidated by these technologies, because it
Yes, I
reshapes.
mean,
Sorry?
you 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 have your big companies that are manufacturers of medical
Yeah,
equipment traditionally, and then
yeah,
right now you have these disruptive technologies that are
yeah,
entering the medical space.
yeah.
What is the response from these
No,
big manufacturers? Because it's also about a profit.
yeah,
And
yeah.
then just to add into that profit, there's a question here in the Q&A, and it says, because it brings out the human element.
Mm-hmm,
It says that traditionally, human medical providers would be held accountable for misdiagnosis.
mm-hmm. Uh, yeah, so there's
But
two
what
issues.
happens
There are
in the
two issues.
case of
Uh,
the use of artificial intelligence
right.
where there's no
Yeah,
human?
yeah, yeah. Two issues, two really important issues. The first one is, you know, I do a lot of training of physicians and healthcare leaders, and yeah, they are resistant for obvious reasons. It's they see it as an encroachment into their profession. The reality is, the profession as it stands, the capacity capability of the profession to meet the demand does not exist. So, but they will still resist. It's a huge issue it's a huge barrier that we try to work against, is the actual cultural one, with physicians, with doctors, with nurses. They're threatened from a job security point of view. And that's a reality that we have to discuss. All of these technologies have the propensity to discuss the profession, to disrupt the profession, make some functions that they perform redundant. So there will be resistance. Of course, there's resistance from major manufacturers. If you made a blood pressure machine, uh, for centuries and you have significant market share, and now people can take the blood pressure using a phone camera, they're going to push back. And they push back in many ways. They try and influence the regulatory space, they try and influence the political space, the policy space, and you get this pushback all the time. My job is not to defend the industry or the profession. My job is to make sure people have access to care, what care they want, when they want it, and at an affordable rate, or where possible, free. So those are, it's part of the resistance we have to manage, is part of the change management we have to manage. In terms of the litigation and responsibility, I gave you the error rate. Doctors get it wrong 12% of the time. Medical error rates are high. To me, technology can actually improve that. Now, bear in mind, doctors are not found liable for misdiagnosis. Okay? They're only found liable for negligence. Misdiagnosis is part of the profession. It's an acceptable, if I misdiagnose you, that's not negligence. It means I'm human. I get it wrong. The only problem is we get it wrong too often, okay, either from a diagnostic point of view or treatment point of view. With AI, we can reduce that rate. Is AI 100% perfect? No, but it's better than humans. Bongani, you raised the issue of the X-ray. Every AI to read an image is 10 times better than humans. Okay. All of these technologies are far better than humans. It's just a fact. That's the power of artificial intelligence. It's able to process much more information better, quicker, cheaper, and faster. Yeah, that's, I think people just need to develop a trust in this. will the machine make a mistake? Of course it would do, but not at the same level and rate that physicians do. Okay, so the one of the reasons that we use and encourage AI is because the misdiagnosis rate is so high. I gave you the stats in it. I mean, patients don't know that, but I'm telling you that I'm a physician. I speak to my colleagues very frankly and honestly that we are not perfect. In fact, we are far from perfect. And we need to change that. And AI and digital technology is the opportunity for us to do what we're doing, but do it better. Okay, so that's misdiagnosis, but I'm sure some of what you were talking about is kind of litigation and stuff like that. And yeah, I mean, you can litigate a hospital or a doctor. The question is, who do you litigate, if the AI solution gets it wrong? Do you litigate the provider or the developer? Do you litigate the person who sold you this? Do you litigate? I mean, to be honest with you, we really have no clarity in terms of that at the moment. Okay. But, if you go and see a physician and he says you're fine, you had a bit of a cough, he takes an x-ray and you're fine and says, the x-ray is clear, you go home. And then, of course, your cough continues and then you're diagnosed with tuberculosis and you're ill. But there's an AI solution to help the doctor diagnose that, and he does not use it. You have a right to litigate the doctor as well. So this is going to cut both ways. If there is an AI solution, the doctor does not use it, shouldn't you be able to litigate? And I think yes. Okay, and I think we're going to start seeing cases emerge where doctors get diagnoses wrong because they are not using artificial intelligence, and they can be litigated against as well. So it's open territory. We're working through all of those things. And ultimately, I don't know where we land in terms of who's responsible. At the moment, what we do in our health system, which is one of the largest in the US, we actually inform patients, get their consent to be able to use AI. So that's just to protect us. But I think that, may become common practice. Yeah.
Oh, quite interesting. Colleagues that in the audience, if you can put your questions in the Q&A. And while we're still waiting for further questions, Prof, just to understand, different countries are in different levels or stages of development.
Yeah.
There are those in the global north that are far advanced, and us in the global south, we're still struggling with some of the basics. And there's no doubt that this artificial intelligence can improve the health performance. But what are the capabilities on the human side?
Yeah. On the human side.
On the governance side, on the
right.
clinical
Okay, so
governance
to be
side,
very honest with you, in South Africa, that's zero.
needed
We're one of the very few countries
to ensure that
you want to repeat that, Bongani? You're talking about capacity and capability.
Yes, I was asking what are the human capabilities that are needed,
right,
as well as the clinical governance that will be needed
yes,
in order for us to adopt artificial intelligence and use in the health sector in the right way.
Right. Okay, so this is not unique. Really good question. Not unique to healthcare. Okay, it's everywhere. I mean, it really starts at the top. We need a national policy on artificial intelligence across industries and sectors. Each industry and each sector needs their own AI strategic document and policy. It's non-existent in South Africa. We're one of the few countries that does not have an AI policy and framework in place. Admittedly, I'm now working with them to start putting these things together. Okay. It starts with having that policy and strategy document in place that addresses some of the key in healthcare, the key challenges that we need to use artificial intelligence for. And then based on on what we intend to use it for, we do a kind of full audit in terms of what's required to do that. Okay, now that's number one is human resources, AI literacy, and digital health literacy. Okay, that's a huge problem. We don't have a critical mass of people in healthcare, whether they're providers or not, involved or have the levels of literacy that's required. Okay, but we're addressing that now. We have started. I mean, one of the reasons I was invited to talk to you about this is because I'm actually working in the health sector in South Africa now with the ministry and a lot of the provinces, medical associations, etc. We're starting, and my approach is always let's develop literacy first. So we have a critical mass of people who understand artificial intelligence before we start deciding how to use it, where to use it, and what it requires. So for me, the number one thing would obviously be the policy framework. Number two is going to be AI literacy, which we have started. By the way, we've partnered with the College of Medicine, with South African Medical Association, Dental Association, medical schools, etc. And we're rolling out AI education in medicine and healthcare at the moment. We've just started. Okay, the course launches on the 1st of September. For 2,000 rands, you can get a certificate of AI in medicine and healthcare. And the reason it's that price is because we use digital technology to demonetize, democratize, and dematerialize it. So you can take the training on your phone or computer, whatever you have. So yeah, we're addressing it in health and healthcare. It's something that we want to make available across sectors. Certainly the public sector, local government is really important sector for us, to contribute to the kind of national agenda. And yeah, it's going to start with that. It's going to have to start with developing AI literacy amongst all the sectors. And then, of course, there are we need the infrastructure, we need the data, we need the computing power, we need the storage, we need the necessary cybersecurity systems in place. We can all get there by having sufficient numbers of people who are literate about AI. Okay. The rest we can put into place pretty easily. So there's an approach nationally and sector based that we follow to ensure people succeed. I mean, the ultimate goal is to develop sovereign artificial intelligence, meaning that we develop a solution for people who are using it. Okay, that's really critical because the X-ray AI developed for the US population or the Swedish population will not necessarily work in South Africa because the patient demographics are different. If I develop an AI solution in the Western Cape, doesn't mean it can translate to KZN or to Gauteng because population bases are different. So we need literacy so that we can develop sovereign AI using local data. And the more hyper-local your data is, the better the performance of the algorithms. So it's a very structured approach that we're following. And we are a bit late in South Africa, but better late than never. So, but we've started the journey. And one of the reasons I'm in the country now at the moment is actually to do this training and have policy discussions with different ministries, etc. Yeah.
Okay. Thank you very much, Prof. I do not have any further questions from the Q&A, but if colleagues have, you can post that as we are about to close in the next few minutes. Just to put another point here, this AI, I think this webinar has demystified the use of AI in the health sector because of these questions that we had. But I just want to add another point that actually it is not a threat to jobs in the health sector because also it can contribute to job creation through this democratization. You can have many of young people who can enter the space and challenge big industry that used to be the only ones that dominate manufacturing of medical equipment.
Right.
So it is a win-win situation because you are democratizing it. It creates
Yeah.
jobs. On the other hand, it contributes to economic activity.
Yeah.
So there's no more question coming from there. That's Prof. Pillay from Alabama University, Birmingham. Thank you very much for having made time to join us. Or as I was about to close, then there comes a question from one of our colleagues, Rapira. It says, does the use of AI need informed consent? Also, how to use AI to seek informed consent? I think I'm too late for that question, but I think you understand it better than I would do.
Yeah, no, I
Thank
mean,
you.
it's you really don't need to, but I think we certainly do that. Okay, where we are in the whole medicine specifically. So, because of the nuances of medicine and working in patients and potential upside and downside, we thought the easiest way to start the implementation process and get these AI solutions out is to adopt an informed consent approach. Okay. But, we use a lot of AI in the back operations as well. In fact, we use AI more on the operational side of medicine than on the clinical side of medicine. Okay. So we use it, to help, and this is where the application in the public sector is really good. We have chatbots answering patients' requests, taking appointments, making appointments. We have artificial intelligence recording conversations between doctors and patients and automatically putting it into the chart, etc. For all of those kind of operational applications of AI, you don't need informed consent. But I put a policy in place in my health system that it's used for clinical applications to help with diagnosis, to help with treatment, then it's in the interest of the patient and the provider to seek informed consent. Can you do that preemptively using AI? Yeah, absolutely. So you can enter into our e-medicine platform and you'll be talking to an AI, but you could easily just build in the informed consent there, informing the patient that they're interacting with AI and, if it's not supported by a human doctor's opinion, that it doesn't carry any weight. So yeah, you could build that in easily. That's kind of it's called the human in the loop approach to medicine. Although we use AI, physicians have to consider a bit cumbersome, etc. But we're in the early days for clinical medicine, and we don't want to get it wrong because we don't want to start losing trust in this.
Okay, thank you very much, Prof, for these insightful views that you have shared with us. I think this is just the beginning of many in the series of conversations that we'll be having with you. And a very much big thanks to our colleagues and partners who have made time to attend this webinar. I think we are going to adjourn from here. Keep a look out on the NSG social media platforms for more webinars related to this theme. And I think this is an approach that we'll be using towards building sector-specific capacity development in the National School of Government. And we look to engaging further with you, Prof. Thank you very much, ladies and gentlemen, and enjoy your afternoon.
Thank you. Thank you. Thanks to all who attended as well. Thank you very much. Bye-bye.